Hello, this is Connie Welch. This is the fourth video update for LifeBeyondHepatitis.com. Wanted to go ahead and give you this week's update. April the 9th is when I started the treatment for chronic active hepatitis C with using the new protease inhibitor Incivek. So this has really been a mile marker week. I have completed 4 full weeks of the triple therapy for hepatitis C. So I'm actually celebrating this week with this mile marker. I wanted to go ahead and show you this week a box of Incivek. Comes in a box. Let me see if I can get this in front of the camera. And each box is individually wrapped for a week's worth of medicine in one small box. And then these boxes go inside a large box. So what's exciting is that I have now completed one whole entire box of Incivek. So it is totally completed, and I'm very excited about finishing this whole box. And what this means is on Incivek, you take for 12 weeks at the onset of treatment. And when doing so, for me, this means that I have completed 1/3 of part of the leg of this treatment. So on July the 2nd is when I will have completed the whole entire regimen of the Incivek part of the therapy. And then I will continue on with the PEG, Interferon, and Ribavirin to the completion of the treatment, which could be approximately 40 weeks or more. So that will depend on my blood work and what the doctor determines at that time. So, and at this time, I've also finished an entire bottle of Ribavirin. Ribavirin and Incivek are oral pills that you take. The Incivek is 2 large pills that you take 3 times a day, and the Ribavirin are 3 pills that you take 2 times a day. And then the PEG interferon shot is the injection that you take once a week. I do mine on Monday evening. Now for the update from last week I really had, I would consider probably a more challenging week. I started last Monday night, prior to even when I took the shot. I started feeling a little shaky and just a little just feverish, which sometimes in the evening fever does go up a little bit. But then I took the shot on Monday night about 10 o'clock. I woke up around 1 o'clock that morning and just was feeling very high fever. My fever stayed close to 101 for about 24 hours, which that's a little unusual that it would go up quite that much and stay on for that length of time. Normally, I might have fever in the evenings and it might last for several hours, then it would go down. But for some reason, I don't know why, on that particular night, it hung on longer. But I did experience some of the nausea and vomiting, unfortunately. But that was just 24 hours, and after that, it did pass. I know it wasn't a stomach bug because this kind of goes along with some of the side effects that I have experienced. But it did not stay around, and I was very grateful for that. So after, by Tuesday night, we were able to get some medication, I believe it was called Zofran, that was able to help me with the nausea to really knock that out, so that I was able to go ahead and keep getting liquids down, and the Tylenol that the doctor told me that was all right for me to take the amount, and to be able to get my fever down and be able to get liquids in, and so that did bring me some relief. So I was very glad about that. On Wednesday, Thursday, and Friday, I just felt extremely washed out. So the fatigue was probably the biggest issue. The heavy metal taste has been something that I've really had to deal with a lot. It's been more intense than other times. But the thing that I have found that has really helped that has been wintergreen lifesavers. And so if you're dealing with treatment and if you're finding that you're having that heavy metal taste, something like maybe the lifesavers, the mints, or something like that would perhaps help you too. But that has really helped me a lot. I think the trick is not to have so many that it feels like you know, the roof of my mouth or my tongue feels kind of like sandpaper. But to me, if that helps me get through this, then that's fine. But that was last week, and now yesterday I completed a large round of blood work that I had done that needed to be done for the 4th completed week of treatment. This morning I did receive word back from my doctor that my thyroid levels are off. They're elevated right now due to, they think it's probably the treatment that's doing that. So they're just going to monitor this very closely. They're changing up the dosage of the thyroid medicine that I take since I do have hypothyroidism. So we're adjusting that dose, and so we'll see what's going to happen with that this next week. Next week, I do see my endocrinologist and also my hepatologist. So I'll get the results from the other part of the test that was done yesterday. The virus load test was done, so we will find out how I'm responding to treatment. So be kind of anxious to find out what levels, those are, and compare them to the baseline that was taken before treatment started. Also, my white blood count and red blood count to see where those are right now as well. So anyway, stay tuned for that. But to celebrate this special time of getting the Incivek completed on the website lifebeyondhepatitisc.com, I'm offering a special giveaway drawing this week for a Kindle Fire. So I hope that you'll come and visit the website, and it's very easy to enter the drawing. Just post a comment on the post. It's about what you have to celebrate right now going on in your life. And it could be something silly, it could be something serious, just whatever that you have that you feel encouraged about and that you're celebrating right now in your life, and just place that down. This is just a lot of fun, and just want to be able to give back to everybody else, and just thank you for your support, your prayers, and all your you're just been really awesome support to me. So, and I appreciate it. So just wanted to do something to give back to you guys. So come and enter the drawing, and I hope you have a lot of fun. And stay tuned this next week when I report to find out what my blood work shows. So talk to you then. Bye-bye.